Hello everyone, this is Dr. Isatu Kakay-Diallo from Sarah Network Health Talk. Today, I wanted to talk to you guys about something that is very common among us. You know, as we age, sometimes could be a risk factor. Sometimes our family history is a risk factor, and nothing with those things, put us at higher risk for multiple medical conditions. So let's talk about hypertension. What is hypertension? Right? The layman say high blood pressure, meaning your blood pressure or the force against the arteries within the walls are pretty high. So with that, patients might experience different symptoms, and these symptoms sometimes can lead to complications if you don't do anything about it. So what is hypertension, in a description? It's a condition in which the force of the blood against the arteries of the wall is too high, right? So with that, it gives you a blood pressure above 140 millimeter mercury over 90 millimeter mercury. So we're talking about the higher number or the top number when you take your blood pressure. So you take your blood pressure, you expect the top part of your blood pressure to be anywhere from 90 to 140. And the bottom part of your blood pressure should be anywhere from 60 to 90. So anything beyond that, actually you are considered, somebody with high blood pressure. It could be a high, a pre-hypertension, or sometimes you may need to repeat this blood pressure at multiple different visits up to 3 times. With that, you can be diagnosed with high blood pressure. So let's talk about some of the risk factors that put someone at risk for high blood pressure, right? For example, if you talk about high blood pressure, you can say there are things that you can change in your life. That's called modifiable risk factors. Things that you cannot change in your lives when it comes to high blood pressure are things that, like your age, you cannot change your age. Right? Whatever your age is going to be that, or you're going to continue to be older, right? And what is your gender? If you are a male, female, you cannot change those things. Those are the non-modifiable risk factors for high blood pressure. And then you talk about, family history, genetics. You cannot change your family history. If you have a family member with high blood pressure, that you're talking about your parents, right? Or other, close relatives are put you at higher risk compared to somebody who never had a blood pressure in their family, right? So this is in line with many health conditions that we see out there, And then you talk about what can I change in my life to really control my blood pressure, right? Because with the high blood pressure, it puts you at risk for stroke. And what is stroke? Stroke it's a whole topic on its own. We're talking about, lack of oxygenation to the brain, or there's a blockage that's leading to a stroke, right? So with that, it puts you at other complications down the line, which we will talk about on a different segment. But for today, let's say things that I can change about my life. Like you could do exercise. Daily exercise can really help you in how you can control your blood pressure, moving around, don't sit down too much, like watching TV all day and then sitting on the couch, those are things that can increase your risk. But if you change those things in your life, definitely you can modify, and that's where the modification comes about. And then if you are somebody that drinks alcohol, you may want to cut down on the alcohol that you take. And also, if you are somebody who is sleep deprived or deprived socioeconomically, can also put you at risk for high blood pressure. Why is that important in this segment? It is because sometimes people don't even have a good way of getting the right meal. They just eat anything. Why? Because they don't have the finances, so they eat anything that makes them feel like they ate something for the day. But if you really have the finance or the resources and you have the economic status, then you can go out there, buy food that are not too salty, right? When we talk about salty food, we're talking about, canned foods. People eat, the grab and go. They're not looking at the calorie count. They're not looking at the sodium content. When we say sodium content, we're talking about the salt, the amount of salt within each diet, right? So you should be getting about 2 grams of salt a day. So people that have high blood pressure, if they have too much salt, what it does, it causes them to retain fluid. And you retaining fluid raises your blood pressure, and also it causes a constriction of the vessels, or your arteries, that elevates your blood pressure. And another thing, you can try to modify is your stress level. If you are somebody who's overly stressed, they take your blood pressure. Let's say you just got out of, an argument with somebody or something that was very stressful for you. If you come back home and then they check your blood pressure, believe it or not, it's going to be on the high side, right? It would not be part of the normal routine blood pressure that they take for you. And also, another thing you can do, is like to sleep well. If we don't sleep well, it also affects our blood pressure, affects how we do things on a daily basis. What are some of the criteria, according to the JNC, which is the Joint National Commission 8 hypertension guidelines algorithm? So somebody with that is above the age of 18, with high blood pressure, you want to implement first how you want to treat this patient. Once you already diagnose them after 3 consecutive, blood pressure readings that are above 140/90, so you definitely want to try to, try lifestyle modification first before putting them on a medication. If you do that, I believe that can really help in how you can control their blood pressure. If that doesn't work, and let's say this person have other medical conditions, we're talking about diabetes, kidney problems, right? Or if they don't have no medical problems, right? So those people, you're talking about anybody at the age of, 60 and above, their blood pressure goal really should be, 150, less than 150/90. And somebody that is under the age of 60, their goal is less than 140/90. And for the person that have diabetes or kidney problem, right, chronic kidney disease, these are patients with all ages, right? It doesn't matter how old you are. So your goal for a blood pressure, so that you don't develop a stroke or heart attack, should be less than 140/90. And then if you are somebody, without diabetes, and you are under the age of 60, definitely again, we want your blood pressure to be over, less than 140/90. Some things that you can treat patients with, for high blood pressure, you're talking about, calcium channel blocker, you're talking about beta blockers. These are different types of medications that patients should learn to take. And the myth here, or sometimes what patients tend to understand, is that, well, I took my blood pressure medication, now it's all controlled, I'm at 120/80, so I don't need my blood pressure. That's not accurate. You should actually continue to take your blood pressure, unless that blood pressure is significantly low, because you should be checking your blood pressure on a daily basis. With that, you know what your blood pressure is, you know what your heart rate is, and that can really help you in managing your blood pressure and taking your medication adequately. So taking your medication doesn't mean that you should not watch your diet. You should also watch your diet, and that's something family members that help patients at home make food can really watch what they're cooking for this family member. You want to avoid certain things that are high in sodium content, then that can also help the patient with that. Some patients, what they call white coat syndrome, tend to have, when they come to the doctor's office, maybe at home, everything is fine. Their blood pressure is normal because they're taking their medication. But because of that fear, anxiety, and this is where we talk about, if you have a high anxiety level or stress, your blood pressure tends to be on the high side. But when you go home, everything is fine. But at the doctor's office, they call that white coat syndrome or white coat hypertension. And that sometimes can mask the true hypertension. So that's why it's good when somebody comes to the clinic or to the office to make them sit down for at least 5 minutes. There is a proper way of checking the blood pressure. These are all the different things that can affect your blood pressure. So that should be considered as we check one's blood pressure. Some other things, we already talked about the risk factors. Your age, being obese can put you at risk for high blood pressure. and we've talked about, what are some of the symptoms really when somebody have high blood pressure. What are some of the things that they would experience, or what can they tell you is happening to them? This person might feel dizzy, they might have a headache, they might feel like, they're fainting because they become lightheaded. Their vision is going to be blurry. They might have nosebleed. Some patients might have nosebleed, and they may have, cardiac problems like arrhythmias. And sometimes they may complain of chest pain or palpitations, right? And sometimes they may have difficulty breathing, trouble swelling, swelling, abdomen. So their abdomen will be fluid accumulation, in the abdomen. Sometimes they might be very tired, and their lower extremities will be swollen because why? They're retaining fluid. So there's not that, backflow of blood into their heart, because as I'm talking to you right now, my heart is pumping blood into all the different chambers. So the blood goes in a circular motion. It finishes one cycle and go to the next and comes right back. The whole thing starts all over again. So our best approach really definitely, cut down on sodium. The sodium content can really help us. Definitely, alcohol consumption, you want to decrease that. Increase physical activity to help you in how you see hypertension. So like WHO, which is the World Health Organization, really sees hypertension as a serious medical condition, and it can increase the risk of heart, brain, kidney, and other diseases. It is the major cause of a premature death worldwide, with up to 1 in 4 men, right? So every man, let's say you have 4 men in this room, 1 out of them will have high blood pressure. And then women-wise, it will be 1 in 5 women have high blood pressure. So those are things that we should look at. So as you can see, men are at higher risk for developing high blood pressure compared to women, right? So, and the cost of controlling high blood pressure is significantly increased, right? And so as it is right now, which I've already, outlined, I'll call 4 people are on the street, and then you take their blood pressure. There'll be 1 out of those 4 men that have high blood pressure. Just same goes for 1 out of 5 women will have high blood pressure. So there are other causes that can lead to high blood pressure. So what are you talking about? Like secondary hypertension, meaning it's not any of the other ones that we've talked about, the risk factors or things that the person is doing. You having other medical conditions put you at risk for high blood pressure. Prescription over-the-counter medications, right? Like somebody who always take medication over the counter tend to be, hypertensive, because that medication actually has something within the ingredients that raises the blood pressure. So NSAIDs, for example, which is like Motrin, ibuprofen, can put you, your blood pressure higher, give you a secondary hypertension. And then you talk about oral contraceptives for the young girls that are on contraceptives, so that's why before they start you on oral contraceptives, they will check your blood pressure to see, are you hypertensive to start with? So if that's something the case, then they could try to manage these things. And the other thing here is steroids. Sometimes patients are being put on steroids because they need to be controlled for inflammation. Like we're talking about COVID-19. People that have COVID-19 are benefiting from, steroid treatment because there's inflammation within the lungs, And then also some, some decongestants, like, can cause you to have, high blood pressure. And then we've talked about anything that contain antacids, or sodium can tend to raise your blood pressure. But the take-home message here is definitely, we should watch what we eat. So if you have your plate, you want to divide that plate into 3. Why do I say that? Half of it should be fruits and vegetables. The other half that you have to divide into 2 will be, 1 with carbohydrate, then the other one is protein. So if you do that, you would definitely help your blood pressure to decrease significantly. So for example, let's say if somebody is, who's trying to lose weight, they will decrease their blood pressure by minus 5 millimeter mercury. Just exercise alone can do that for your blood pressure. And then somebody who uses diet And that's why diet is very important. Can decrease your blood pressure by 11 millimeter mercury, meaning because the numbers we were talking about, the 140/90, so if you do diet alone, not adding medication or anything, you decreasing your blood pressure, you know, significantly. So let's say if it was 144/90, you deduct, you know, 11 from that. So you're doing well just doing the diet. And then you talk about, you know, physical activities, right? So different types of physical activities, you can lose, you know, or decrease your blood pressure to from anywhere from 5 millimeter mercury to 8 millimeter mercury. So these are things that you can do in combination with treatment, which is pharmacological treatment, medications that the doctor prescribes for you. And with that, if you are taking 2 medications, you're probably going to be taking 1 instead of 2. So that's a good thing. So for that, we'll leave it here and we'll continue from this topic to the next segment, you know, about what else hypertension can do to you. Thank you.